We all grow up playing hide and go seek, but as you get older, games of hide and go seek become fond memories. But what if as you grow older, they don't? What if with every new friendship or relationship, you still felt like you had to hide? You felt like you had to hide because other people would judge you, they wouldn't understand you, or they would be afraid of you. For 125 million people worldwide suffering from psoriasis, this is often their very story. Psoriasis is an autoimmune disease. It is not contagious and it is not curable. But there are treatments. The development of new treatment options has allowed those with psoriasis to find support, further understand their illness, and come out from hiding. In my research studies, I have evaluated one such treatment option, Secukinumab. Secukinumab represents a new class of biologics and is one in which many believe sets the new standard of care for future psoriasis medications. Before it became available to the public, Phase 3 clinical trials demonstrated that Secukinumab treatment works and it is safe. But while clinical trial results are promising, we must question how well the results are applicable to the general population because patients in real-world clinical settings often have additional comorbidities, are receiving additional treatments, and are from a potentially broader background. We conducted a chart review of psoriasis patients receiving Secukinumab and asked two core questions. Are our patients achieving remarkable results in skin clearance, and what side effects are our patients experiencing? After conducting our study, our results are comparative to that of clinical trials. When we look at the efficacy results from clinical trials, 77 to 81% of patients experience PASI 75 or 75% or more clearance in their psoriasis skin lesions by 12 weeks. The results from our study fall within this range where 78% of patients experienced 75% or more clearance. Just as important as efficacy is safety. In our study, similar adverse events were reported as those seen in clinical trials, the most common being upper respiratory tract infections, cutaneous infections including bacterial and fungal, diarrhea, and sore throat. In summary, the results from our study complement the results seen in clinical trials and provide a more in-depth safety profile to help guide how physicians prescribe Secukinumab. While Secukinumab appears to be an effective treatment option for patients in real-world clinical practice, it is not clear of risk and it is important for physicians to be aware of the infectious risk accompanying Secukinumab and monitor patients accordingly. Our goal as a research group was to challenge the newly available therapeutic options for plaque psoriasis that have the potential to change the people's lives around the world. It is a work from research teams like ours in partnership with the Canadian Association of Psoriasis Patients that those faced with the everyday challenges of psoriasis can take control of their disease, regain their confidence, health, and self-empowerment, and ultimately no longer feel like they have to hide.